Hello, my name is Dr. Shahzad Mustafa, and I am an allergist located in New York. I would like to tell you about one of my patients with severe asthma and why I chose to prescribe TEZSPIRE, tezepelumab-ekko. As you may already know, TEZSPIRE is approved as add-on maintenance treatment for adult and pediatric patients aged 12 years and older with severe asthma. TEZSPIRE is not indicated for the relief of acute bronchospasm or status asthmaticus. In two pivotal studies enrolling a broad all-comer patient population, meaning no baseline biomarker level requirements, TEZSPIRE reduced asthma exacerbations by up to 71% in the Pathway study and 56% in the Navigator study versus placebo. In addition, TEZSPIRE is the only biologic to demonstrate a statistically significant reduction in exacerbations in patients with blood eosinophils less than 300 cells per microliter. Compared to placebo, TEZSPIRE impacted asthma exacerbations leading to ED visits, urgent care, or hospitalizations by 79% versus placebo. The results are descriptive only. Over the next few minutes, I will share with you information about the TEZSPIRE mechanism of action. Please note that the results are descriptive only and their clinical significance and impact on asthma have not been definitively established. By blocking TSLP at the top of the inflammatory cascade, TEZSPIRE can help reduce biomarkers associated with airway inflammation. In the 52-week Navigator study, a reduction in blood eosinophils and fractional exhaled nitric oxide was observed at week 2, the first time point measured, and that reduction was sustained throughout the 52-week study. In addition, TEZSPIRE resulted in a reduction in serum total IgE concentration throughout the 52 weeks of treatment. TEZSPIRE has also been shown to impact tissue eosinophils and airway hyperresponsiveness, AHR. In the Cascade study, approximately 100 patients with moderate to severe asthma underwent bronchoscopy and biopsy after receiving either TEZSPIRE or placebo for up to 52 weeks. Treatment with TEZSPIRE resulted in an 89% reduction in airway submucosal eosinophils versus a 25% reduction in placebo-treated patients. The assessment of AHR was an exploratory outcome in Cascade, a mechanistic study. The figure shows the least squares mean change from baseline in cumulative dose of inhaled mannitol required to result in a 15% reduction in FEV1, otherwise known as the provoking dose 15 or PD15. AHR, as measured by a response to mannitol, was reduced in patients treated with TEZSPIRE versus placebo, with the end of treatment mean change from baseline being 197.4 milligrams with TEZSPIRE versus 58.6 milligrams with placebo, indicating a reduction in AHR with TEZSPIRE. TEZSPIRE is contraindicated in patients with a known hypersensitivity to tezepelumab-ekko or its excipients. Reactions, for example rash, allergic conjunctivitis, can occur after administration of TEZSPIRE. These generally occur within hours of administration, but can have a delayed onset. Consider the benefits and risks. Do not abruptly discontinue corticosteroids. Dose reductions, if appropriate, should be gradual and may be associated with withdrawal symptoms and/or unmask previously controlled conditions. Treat patients with pre-existing helminth infections before starting TEZSPIRE. If patients become infected while receiving TEZSPIRE and do not respond to anti-helminth treatment, discontinue TEZSPIRE until infection resolves. Avoid use of live attenuated vaccines. After reviewing the TEZSPIRE clinical data and the mechanism of action, I thought about patients in my practice who could be appropriate for TEZSPIRE. I would like to tell you about a lovely patient of mine, Yara. Yara is a 40-year-old woman who has been struggling with severe asthma most of her life. Over the years, she has experienced multiple exacerbations requiring emergency department visits, hospitalizations, and intubations. Yara worries that her next exacerbation may come at night while she is sleeping. Yara is adherent to her medications, which include a high-dose ICS-LABA and additional add-on treatments. Despite Yara's compliance with treatment and checkups with my office, she still experiences more than 2 exacerbations per year, and she struggles with cough and dyspnea on a daily basis. This has been her experience. Other patients may present differently. Both her symptoms and exacerbations have led to frequent oral steroid bursts and periods of maintenance oral steroid use. We have ruled out common comorbidities, including allergic rhinitis and vocal cord dysfunction, as factors to contributing to Yara's symptoms and the severity of her asthma. It has been difficult to identify obvious exacerbation triggers, and Yara is not sensitized to common clinically relevant allergens. Her total serum IgE is consistently below 100 international units per ml. Frequent oral steroid use has made it difficult to get an accurate blood eosinophil count. I suspect that a number of factors and inflammatory pathways are likely acting together to drive Yara's poorly controlled severe asthma. My goal is to get Yara's asthma better controlled and reduce the number of exacerbations which have required treatment with oral corticosteroids. If we could do this, I believe we could impact her quality of life. And a good goal for her would be to spend more time being a mom to her 2 children versus focusing as much on her asthma. At our last office visit, I recommended to Yara that we try TEZSPIRE. I explained that TEZSPIRE has been shown to reduce exacerbations and help improve asthma symptom control in patients with severe asthma, no matter the type. By targeting TSLP at the top of the inflammatory cascade, TEZSPIRE can impact multiple pathways that may contribute to her asthma. The mechanism of action in asthma is not fully understood. We reviewed various treatment options available and our treatment goals. After a conversation with Yara, we made the shared decision to add TEZSPIRE. I explained to her that individual results may differ from what was observed in the clinical trials. Yara and I discussed the safety information that I stated previously, and potential risks and benefits, and the most common adverse events associated with TEZSPIRE in the clinical trials, which included pharyngitis, joint pain, and back pain. I encouraged Yara to read the patient information available at tezspire.com. Yara enjoys coming to the office and interacting with my team. I told her that she would come to the office every 4 weeks to receive TEZSPIRE by subcutaneous injection. Yara has recently started on TEZSPIRE, and I'm really looking forward to seeing her back in the office soon. I have lots of questions to ask her, and I hope she'll be excited to share how she is feeling. Thank you for listening to my TEZSPIRE moment. I shared how I made the clinical decision to prescribe TEZSPIRE, the first and only biologic approved for severe asthma without phenotypic or biomarker limitations. I invite you to review the full prescribing information for TEZSPIRE, including patient information at tezspirehcp.com.